In today's presentation, stroke will be discussed, which is considered to be the second most deadly disease of our generation. Why should we care? Stroke kills about 140,000 Americans every year, which accounts for about 1 out of every 20 deaths. In the United States alone, every 40 seconds someone experiences a stroke, and every 4 minutes someone dies of stroke. Stroke costs the United States about $34 billion every year, and that is both to prevent future stroke from occurring and treating current episodes of stroke. Stroke is also a leading cause of serious long-term disability. What is stroke? A stroke occurs due to the carotid artery becoming blocked or leaky. It is important to make that distinction because there are two types of stroke. An ischemic stroke is caused by a blocked carotid artery, while a hemorrhagic stroke is caused by a leaky carotid artery. The lack of oxygen in brain cells causes them to start dying, which is prevalent in both types of stroke, and this creates the key symptoms. These symptoms are important to be aware of because if, God forbid, you are experiencing a stroke or someone near you is experiencing a stroke, you could quickly identify it and seek medical treatment. So these symptoms include feeling of sudden numbness, usually on one side of the body, confusion or momentary trouble walking or seeing. Some risk factors for stroke include having high blood pressure, having a family history of stroke, being African American, being female, and smoking. Some ways to prevent stroke include exercising regularly, avoiding smoking, prioritizing a healthy weight, having a low sodium and low processed food diet, having alcohol consumption in moderation, and minimizing stress. All these prevention methods are similar to our previous video, which was on coronary artery disease. Treatments. So stroke, since there are two types of stroke, the treatments differ substantially between the two types. However, it is important that you seek medical attention as soon as possible, because the quicker you treat a stroke, the better your chances of restoring functions are. So for an ischemic stroke, one will receive medicines such as tissue plasminogen activator. Doctors like to administer it within 3 hours, sometimes within 4.5, but the earlier you get it, the better. Antiplatelet medicine may also be administered, such as aspirin. Additionally, a thrombectomy is an approach to restore blood flow. So for an ischemic stroke, the treatment plan is to restore blood flow through that blocked carotid artery. For a hemorrhagic stroke, it's a little bit different. So the main role of treatment is to stop the bleeding that is occurring from that leaky carotid artery. So one may receive plasma transfusions. Additionally, because of all that leakiness that occurred, there's a lot of blood built up in the head, and that creates additional pressure that is not normal for the head to experience. So one will be monitored for signs that portray this, and that includes restlessness, confusion, trouble following commands, and a headache. Surgery may be necessary, and most likely will be necessary, in order to repair the aneurysm that caused the leakiness, and to remove all that blood that was built up and increased the pressure in the head. So these two types of stroke differ in their methods of treatment, but it is very important to seek medical attention as soon as possible. So I hope you enjoyed this video, and thank you very much for watching.